The next we are going to discuss is the hemorrhage. Hemorrhage, it refers to the escape of the blood from the blood vessels that can occur either internally within the body or externally through break in the skin or the mucous membrane. Now you should know some certain terminology. The first is the hematoma. So the hematoma, it occurs when the blood escape from the damaged blood vessels and collect within the surrounding tissues, leading to localized swelling that is known as hematoma. Ecchymosis, they are the larger area of the blood extravasation into skin or mucous membrane. So typically causing discoloration, either purplish or bluish in color. The purpura, they are the small hemorrhages that measure around 1 centimeter in size that occurs within the skin or the mucous membrane. Similarly, petechiae, they are the tiny pinpoint hemorrhages that appears as small red spots on the skin or the mucous membrane. Diapedesis, it refers to microscopic escape of the blood cells through intact vessels. Now, here is one question. Which type of hemorrhage result from blood escaping from the damaged blood vessels and collecting within the surrounding tissue? So, your answer would be hematoma here. So, hematoma, we discussed that it occurs when the blood it escapes from the damaged blood vessels and collect within the surrounding tissue. That results in localized swelling. So, answer is hematoma. Now, let us discuss the etiology. What could be the etiology? Etiology could be hemorrhage. It can occur either due to the trauma, direct injury or trauma to the blood vessels, or it can occur spontaneously, like without any external trauma, like rupture or weakened area of the blood vessels, or in condition like bleeding disorders like hemophilia, and some certain cancerous diseases like leukemia, where the abnormal blood vessels may rupture. It may also occur in inflammatory conditions like ulcers, inflammation of blood vessels, or infectious diseases. Or it can occur in a neoplastic, the cancerous tumor. They can invade and weaken the blood vessels and increase the risk of hemorrhage that is seen in carcinoma. Or vascular conditions like atherosclerosis, they may lead to hemorrhage. The effect of hemorrhage depend upon several factors, including the amount of blood loss, the rate at which blood is lost, and the location, that is the site of the hemorrhage. Mild to moderate blood loss can be compensated by the body through mechanisms like vasoconstriction, increased heart rate, and redistribution of the blood flow. However, if there is a sudden or severe hemorrhage, that may lead to significant consequences. Now, mild losses or severe losses can occur. Severe losses can lead to profound effects like the shock or even the death. So, shock occurs when there is inadequate tissue perfusion that lead in reduction in the effective circulating blood volume. Other clinical conditions like chronic blood loss, such as from GIT bleeding or menstruational disorders, can lead to iron deficiency anemia. Acute hemorrhage also can lead to hypovolemic shock, so that is characterized by decrease in the blood volume and lead to inadequate perfusion of the vital organs. Now, coming to the shock. Shock is a life-threatening syndrome that is characterized by cardiovascular collapse and leading to decreased venous return and the cardiac output. So, it is characterized by hypotension and hypoperfusion. Now, in shock, the characteristic feature is poor perfusion of the tissues. That would be your answer. So, shock is a state of inadequate tissue perfusion due to decrease in the circulating blood volume. So poor perfusion of the tissues, it is the hallmark of the shock that leads to either cellular hypoxia. So that can manifest clinically as altered mental status, cool, clammy skin, and ultimately leading to organ dysfunction. Now, the cardiac failure, shock can lead to cardiac dysfunction. Cardiac failure itself is not a defining and decreased cardiac output. The shock may cause hypotension and decrease cardiac output, but cardiac failure specifically refers to heart's inability to pump effectiveness. But the cardiac failure, it refers to heart's inability to pump effectively, which can be a consequence rather than defining feature of shock. Similarly, cyanosis or the bluish discoloration of skin and mucous membrane can occur when the tissue do not receive excessive oxygen-rich blood. So it is not universally present in all type of shock and therefore not a characteristic feature. So answer is B. Now let us discuss the various type of shock. The shock can be anaphylactic shock. So this type of shock results from severe allergy reaction, that is type 1 immunological reaction that leads to vasodilation and increased vascular permeability. So that will cause a drop in pH, that would cause a drop in blood pressure and can be triggered by allergens like the insect stings, medication or certain foods. Other type is cardiogenic shock. Other is hypovolemic shock. Remember, it is the most common type of the shock that is associated with hemorrhage. It occurs due to significant reduction in the blood volume that leads to decreased venous return and cardiac output. The causes are acute hemorrhage, severe dehydration and fluid loss from the burns or trauma patient. Other is cardiogenic shock. It occurs when the heart is unable to pump effectively due to conditions. Conditions could be MI, severe arrhythmia, cardiac tamponade, that means the compression of the heart occurs due to the fluid accumulation around it. The shock can be septic shock. Septic shock, it is a severe systemic infection that leads to widespread inflammation and vasodilation. So that results in hypotension and impaired tissue perfusion. Now, what are the clinical features of the shock? So first of all, you would see is hypotension, the decrease in blood pressure due to reduced cardiac output. There is hypoperfusion. There is inadequate delivery of oxygen and nutrients to tissue leading to cellular dysfunction. Other is tachycardia, that is rapid heart rate as body attempts to compensate for the decreased blood volume. Now here is the question. The most common type of septic shock is caused by a gram-negative bacteria. Remember, septic shock it is a life-threatening condition that results from the systemic inflammation response to infection. The infection that may be caused by bacteria, and among that gram-negative bacteria, they are the most common pathogen that are associated with septic shock. So gram-negative bacteria like E. coli, Klebsiella pneumoniae, Pseudomonas, they release endotoxin that trigger a cascade of inflammatory response that leads to vasodilation and increase permeability, and that is why that lead to ultimately shock. Other type of shock could be traumatic shock that can occur due to acute blood loss from the trauma, or neurogenic shock. It results from the interruption of the sympathetic nervous system control over the blood vessel tone, leading to vasodilation. Example could be spinal cord injury, severe head injury, that could be the cause of neurogenic shock. Other type of shock is hypoadrenal shock that occurs due to the adrenal gland insufficiency, particularly during time of stress, like the inadequate secretion of the adrenal hormones like cortisol, aldosterone. So they may cause hypoadrenal shock. Now, which of the following is common to all type of shock? The answer is hypotension. So remember, first of all, we discussed that hypovolemic shock. So that occurs due to the decrease in blood volume. That leads to decrease in the venous return. And decrease cardiac output, and that results in hypotension. The cardiogenic shock, it occurs leading to inadequate cardiac output that leads to systemic hypotension. The septic shock, that is caused by immune response to infection, that leads to vasodilation, increase vascular permeability, and fluid shift out of vasculature. So despite an initially high cardiac output, septic shock can progress to hypotension due to the systemic vasodilation and maldistribution of the blood flow. Other is a neurogenic shock that results from disruption of the autonomic pathway that leads to loss of sympathetic tone and peripheral vasodilation. So that causes a sudden drop in the systemic vascular resistance that lead to hypotension. Now, what could be the pathogenesis of shock? The first is reduced effective circulating blood volume. So in condition like such as hemorrhagic shock, there is significant decrease in the blood volume. So that reduces the venous return to heart and leading to decreased cardiac output and subsequent tissue perfusion. The second is impaired tissue oxygenation. So as the shock progresses, there would be decrease or inadequate delivery of oxygen to the tissues. That would cause reduced blood flow and results in hypoxia, and that would impair the cellular metabolism and the function. The third is release of inflammatory mediators, like in case of septic shock, when the body releases inflammatory mediators like the cytokines, interleukin, tumor necrosis factor alpha. So So these mediator can cause vasodilation, systemic vasodilation, and activation of coagulation pathway that may impair the vascular integrity and the function. Other is the compensatory mechanism. The body, what it does is it initially compensate to maintain the blood pressure and perfusion to all the vital organs. So there would be activation of sympathetic nervous system, release of catecholamines like epinephrine and norepinephrine that would lead to vasoconstriction, increased heart rate, and enhanced contractility of the heart. There would be activation of renin, angiotensin, aldosterone system that would be stimulated by decreased renal perfusion, leading to vasoconstriction, and that would cause sodium and water retention to restore the blood volume. Apart from that secretion of ADH, it increases the water resorption in the kidney, conserving the fluid and increasing the blood volume. The other part is vicious cycle of the cell injury. So prolonged and severe shock can lead to a vicious cycle of the cellular injury. Inadequate oxygen delivery to tissue forces cells to switch to anaerobic metabolism, producing lactic acid. Cellular hypoxia and acidosis impair the mitochondrial function that would reduce the ATP production, and they would compromise the cellular energy metabolism. So if the shock persists and it is not promptly treated, it may lead to multiple organ failure. So the severity of the hypovolemic shock, we compare it amount of the blood loss with the, if it is less than 1000 ml, then compensated by where the body compensating, it is compensated by the body compensating mechanism like increased heart rate and vasoconstriction to maintain adequate perfusion. When loss is 1000 to 1500 ml, mild shock can be occur, that is characterized by tachycardia, hypotension, etc. When it is 1500 to 2000, moderate shock is seen, and when it is more than 2000 ml, severe shock occur where the compensatory mechanism they will fail, and that would lead to organ failure. So what would be the clinical feature here? There would be increased heart rate due to the sympathetic stimulation, low blood pressure as compensatory mechanism, decrease urine output, that would be oliguria. In the shock you would see is a decreased cardiac output. The conditions such as acute myocardial infarction, they can impair the ability of left ventricle to contract effectively. So that results in a reduced stroke volume, and that would cause a decrease in the cardiac output. So there would be, so as the left ventricle it fails to adequate pump blood out, the blood begins to back up into the left atrium and then to the pulmonary circulation. So that can cause pulmonary congestion. So as the pressure rises in the pulmonary circulation fluid from the pulmonary capillaries into the interstitial space of the lung, that causes a pulmonary edema. So the fluid with worsening cardiac function, the fluid it accumulates in the alveolar spaces and there is impaired gas exchange. So inadequate cardiac output it leads to severe hypotension. That is the hallmark of the cardiogenic shock. Now what would be the pulmonary symptoms? The patient would experience dyspnea, that is shortening of breath that worsen as a pulmonary edema progresses. Accumulation of on osculation of the lungs, it may reveal crackles due to the fluid accumulation in the lungs. So what are the signs of cardiac dysfunction? Examination may reveal signs such as jugular venous distension due to the right-sided pressure, cool extremity due to reduced peripheral perfusion, and cyanosis, that is the bluish discoloration of skin and the mucous membrane. Now the septic shock, we know it's a life-threatening condition that is triggered by the bacteria, particularly which bacteria? It's the gram-negative. So activation of the complement system by the microbial products and cytokine that leads to production of anaphylactoxins that are C3A, C3-5. These molecules they cause vasodilation, increases vascular permeability, and promotes the release of the inflammatory mediators. The mast cells, remember, they will secrete histamine. Histamine causes vasodilation. It will increase the vasodilation and increase the capillary permeability. So the inflammatory response trigger activation of the coagulation cascade, leading to disseminated intravascular coagulation in some cases. What are the life-threatening complication of the shock? The first is acute respiratory distress syndrome. This results from the diffuse alveolar damage due to the inflammation and increased permeability of the alveolar membrane. So you will see severe dyspnea, tachypnea despite of giving oxygen. Apart from that, you may see is disseminated intravascular coagulation. So there would be activation of clotting factors that lead to both the thrombus and hemorrhage. So you will see petechiae, purpura, bleeding from the mucous membrane, and organ dysfunction due to the microvascular thrombosis. Apart from that, you can see is acute renal failure. It occurs due to the acute tubular necrosis that is caused by prolonged renal hypoperfusion. So you will see here is oliguria, electrolyte imbalance, and metabolic acidosis. So it may require dialysis if renal function does not recover. Apart from that, you can see is multiple organ dysfunction syndrome that results from the cumulative effect of shock induced tissue hypoperfusion and systemic inflammation that affects the multiple organs. There will be deterioration of organ function, including there would be cardiovascular collapse, respiratory failure, hepatic dysfunction, and coagulopathy. So it would progress to stupor, coma, and the death. So ultimately, unchecked shock may lead to irreversible multiple organ failure. So, shock represents a critical stage where the body compensatory mechanism to maintain tissue perfusion fails, leading to cascade of physiological derangement and life-threatening complications.